Thank you, Shira. So if anyone that was in the journal club last week, we were talking about OSCEs and the 12 tips article. And I stopped on a cliffhanger, which was tip number 8, which is how to set a standard for an OSCE. And then today's workshop will be about standard setting and how you go about determining a pass mark for an OSCE. So when I was looking at that and when I was thinking about doing a workshop on how you set a standard for an OSCE, I thought really this workshop needs to be on what standard setting is, because I think it's something that's quite novel and new that a lot of people maybe are nervous about or unsure about. And it would be a really interesting thing to discuss. So standard setting is all about how we decide what the pass mark should be on an assessment. So I thought what I wanted to start with is just see from the people here, just maybe with like a show of hands, you can wave. If anyone is actually using standard setting to determine their pass marks on any of their assessments. Are there any hands? Shira, I got one. Okay, so I'm really glad. I'm actually going to start with saying about what standard setting is. So I'm really interested to know, just from everyone else, how do you decide what your pass mark is? And what is your pass mark? I know you can even put it in the chat. What are people's pass marks? Is it maybe something like 50 or 60%? I can just see. So Viva not using standard setting yet. I like the yet, because I hope that's going to come. So Viva, that 50%, traditionally 60%, I see Aviva saying. Is that similar for most people, that you have a pass mark that you sort of predetermined is going to be 60%? Do you know how that was decided? Why that is the pass mark? And really importantly, when you set an assessment, how do you know that that pass mark is actually meaningful? How is it a justifiable way to say someone should pass or fail? So that's what we're going to talk about today, is how do you decide on a pass mark that actually means something? Because if you're going to just use something like 50 or 60%, how do we know that actually represents a proper cutoff for what is considered competent and not competent? Are you just really good at setting assessments that always has a pass mark of 60 that accurately represents competence? And when it comes to OSCEs, is 60% appropriate if maybe someone's taking history? Is it appropriate if someone's doing CPR? Are you comfortable with 60% for someone doing CPR? Are you comfortable with someone getting 60% on IV cannulation? So we need to think about, how do we choose a pass mark that is representative of what we consider competence for that particular station? What would you like your surgeon to have gotten who's about to remove your pituitary gland? And also we need to have an idea of how difficult an assessment is. So we've got pass marks that mean something. So I've got a bit of a presentation I want to share with you. It shouldn't take too long. I'm really keen to take questions and discussions, especially because it seems like hardly anyone is actually using standard setting. And the presentation won't be too long, so hopefully we can have a nice discussion afterwards as well. So I should be sharing my screen. Can everyone see that all right?
Yes, it's clear. It's good.
Okay,
Go ahead.
Great. So I just want to discuss the principles of standard setting and then give an example of a standard setting method you can use for an OSCE, because that's really the overriding theme of these three sessions that we're doing. So standard setting is a way of determining a pass score in an assessment, but a true pass score that effectively turns a conceptual level of competence into a number. So effectively, we want to get a number that turns our what we conceive to be a proper cutoff of competence and not competence. Because that's what our pass mark is meant to do. So it's really important to think about why we need a pass mark that actually is meaningful. Is we first of all want to avoid what we would call false positives. So we want to avoid passing students who should actually fail. And this is really important in the health sciences, because if we're passing students who should fail, that puts patients at risk. And it jeopardizes the reputation of your professional qualification if people are coming through that really haven't demonstrated competence. And we also land up pushing students through that maybe are unprepared or not ready for the situation we're pushing them into, and that can often have very negative consequences on the student. Really importantly, we also want to avoid false negatives. So that's a failing a student who should pass. So if a student has actually demonstrated the competence they need to pass and land up failing, that has significant consequences for the student. Financially, if they've got to repeat a year, their time, and it has huge emotional consequences for a student to fail, especially if they should actually have passed. Having a defensible standard setting method is actually critical for the validity of an assessment. It gives us meaningful, valid results that allow for really good decision making. So I want to go back to how we pick a pass mark. So I get the impression from everyone that you are kind of have a pass mark imposed on you. That's maybe either 50 or 60%, or maybe you just have picked those because it's probably what you're most familiar with. But I want you to question whether that is appropriate. So I'm going to give you an example. Say a student gets 53% on a multiple choice question paper. Would you pass the student? Are you happy that 53% is enough? What if I tell you 140 students wrote the test and the average for the test was 84%? Do you still feel like getting 53% is enough to pass? What if 140 students write the test and the average for the test is 43%? Do you still think you would pass the student with 53%? So in the first scenario, maybe a pass mark of 53% is appropriate because we just have a really strong, well-prepared group of students. And they've had a really high average, but most of the students pass because they've done really well. Or this is just a test that's too easy, and we're going to have false positives, students passing who should actually fail. And in the second scenario, maybe a pass mark of 50%, or 53% is appropriate to pass, because this was in fact a very hard test. Or it's a really inappropriate pass mark, depending on how hard the test was or how good the group of students were. So we need to have some sort of standard setting technique that will allow us to know how difficult the assessment was. So to give you another example, say for example, you had a group of students write a test, and the range of marks was between like 35 to 90%. The ones on the left are the students that you're pretty sure have failed, and the ones on the right are the ones that you're pretty certain have passed. And in the middle there, you sort of have a zone of uncertainty, somewhere where you're going to have your cutoff score. So say, for example, you've made your pass mark 50%, that might land up being appropriate. But you have a group of students write, and then your range of marks is between 25 to 62%. You maybe have your zone of uncertainty of where your pass mark should be somewhere there. But if your pass mark's still 50%, you're going to land up failing some students who should really pass. And if the same happens in another assessment, where your zone of uncertainty is a little higher, and your pass mark is still 50%, you might land up passing a lot of students who should fail. So what we want with standard setting is we must be able to account for the difficulty of the assessment and the ability of the group. So just a bit, there's no one gold standard setting method. And there's also no truly objective method. They still all require an element of judgment. So at the end of the day, we're still trying to turn a subjective concept of what competence is into a pass mark, but that pass mark that accounts for how difficult the assessment is and the ability of the group. So the cutoff score may vary with which method you've selected, so you must have a method that's defensively informed by good evidence. And the important thing is that we're going to be reaching a point where just picking a pass mark is not defensible. So you need to start looking at what is a defensible way to pick a pass mark that's informed by good evidence. So when it comes to standard setting, you need to select a method that's the most appropriate method based on the goals of the assessment and the resources available. So is the purpose of your assessment for admissions? Is it for progression from one year to another? Maybe it's for qualification into a profession and it's an exit exam. Is your assessment for identifying students in need of remediation? So you need to first decide what the purpose of your assessment is. The big question you really need to ask is, do you want to compare students to each other, or do you want to ensure a certain level of proficiency has been met? And that's going to help you decide between at least the first two different types of standard setting. So And those are norm reference and criterion reference standard setting methods. So, I mean, we want a standard setting method that meets, I'm not going to read all of these to you, meets a lot of different criteria, and there's no one standard setting method that does. But what you want to do is pick the one that's going to be most appropriate. And I'm going to show you borderline regression as a way that works really well in OSCEs. So just a little bit about what we mean by norm reference standards. These are what we call relative standards. And they compare the individuals taking an assessment. So they sort of reflect group performance. So an example of a norm reference standard is if you predetermine a pass or fail rate. So say, for example, you say 50% of students are going to pass, or you can maybe say a certain standard deviation above the mean is going to pass. So it results in a fluctuating pass mark, but a set pass rate, which is consistent. The problem with norm reference standards is it doesn't take into account varying group ability. So if you're going to say the top 50% students always pass, the top 50 is going to pass regardless of how strong the group is. And some years, if you've got a really strong group, you're going to have really competent students who don't pass. And some years, if you don't have such a strong group, you're going to maybe have students who are not so competent passing. Because you've got a fixed number of students that will always fail, regardless of competence, which can be really unfair. And also, year on year, you'll have students of varying competence that'll pass and progress. We don't actually know what the student knows, only that they were in the top 50% of the students that were there. So norm reference standards aren't great for assuring a level of competency has been met, but they're really useful for selection processes with a limited number of positions. Say, for example, you've got 100 positions in your class and you want to fill it with the top 100 candidates. It's really useful for admissions exams where you're always going to take the top 100. And yeah, some years you'll get a stronger group than others, but you've always got to fill the seats. So that's the only time you're really going to use norm reference standards. Criterion reference standards are what we're going to speak about today, which is our absolute standards. So it's a way of determining a cut score that demonstrates minimum competence that needs to be achieved by every student, irrespective of how the rest of the group does. So standard is basically you're taking a conceptual qualitative definition of competence and then turning that into a cut score that reflects that standard that the students need to meet in order to demonstrate competence. So this is what we use for high stakes decisions. So we predetermine a pass mark effectively that all the students need to get, and then our pass rate will fluctuate. And what's really nice about this is theoretically all the students can pass. If all the students demonstrate competence, then all the students should be able to pass, and that should be something you can aim towards. That if you've got really good teaching and learning practices and the students are really well prepared, they can all pass. And I really like this. In our OSCEs, we have a really high pass rate, but I can defend that really high pass rate because we use very strict standard setting. So I can be confident that I have a high pass rate because the students are well prepared and not because it's an easy assessment, which can give you a lot of confidence in your pass marks. It does mean all the students can fail if all the students aren't prepared, and that's actually really important. If you are in an airplane that is about to land, you hope that that pilot at some point demonstrated at least minimum competence in airplane landing. And you hope if in that year, none of the pilots were able to demonstrate minimum landing competency, that they didn't pass anyone. You hope they weren't like, oh, well, we still normally pass 50%, so let's push these 50% through, because that's going to have serious consequences. And then the same should really apply to the health sciences. So you want to know that any single person has actually demonstrated minimum competence. So we want a pass mark that we are confident actually represents that. So it needs to account for the difficulty of the assessment. And that's the really important thing, is that if we know that an assessment is really hard, then we can make sure that we don't have a really high unnecessary failure rate. And if we have a really high pass rate, we need to be confident that it isn't just because the assessment is easy. So there's a couple of different standard setting methods. So we've got some of our absolute criterion reference standards can be test-centered, and we base those on the examination materials. And probably the most well-known one is an ANGOF. So we usually use those in written exams as when a panel sits and decides on every question in an assessment on how difficult it is and how well they would expect a borderline student to do. We're going to be talking about the examinee-centered ones. And those are based on live student performance. And borderline group and borderline regression are the ones we're going to talk about. And these are great for performance assessments, so like OSCEs and workplace-based assessment. You do get some compromise methods that use a bit of absolute and relative methods, and that's the Cohen that many people will have heard of. But there are lots and lots of different standard setting methods that you can read about. So obviously we don't have time to go through all of these today. Today is really about talking about a standard setting method that you can use for an OSCE. So the one we're going to talk about is borderline regression, but I want to start with borderline group because this is where borderline regression sort of evolved from. So it's examinee centered, and it's really based on an important concept, and that's the concept of a borderline student. So a borderline student is a student that is your minimally competent, just good enough to pass. So if you think about the students that are ready and not yet ready, this is a student right on the edge. That if you think of a student that you lie awake at night wondering if they're going to pass or not because they're right on the edge, that's your borderline student. It's really important. This is not your average student. Your average student should pass. This is the student that's right on the brink of competent and not competent. So what we do is, now this is the practical way we actually apply the standard setting, is when we have an OSCE station, we don't preset a pass mark for the given OSCE station. We have a normal checklist rubric for the examiners, and right at the end of the station, we ask the examiners to give the student a global rating independent of the checklist score. So we don't ask them to total up the checklist score. Independent of the checklist score, we ask them to make an overall holistic judgment of the student's performance. So this is just the bottom of one of our OSCE stations that we've cut off. So you'll see they mark on a rubric all the way down to the end, and then you'll see a separate section that says global rating for standard setting purposes, and then they've just got to tick either it was a clear fail, the student was borderline, the student passed, or the student was excellent. And what we're trying to do is we're going to try correlate what mark matches what was considered borderline performance in order to determine a pass mark for the station. So the really important thing is it does rely on each expert's opinion if the performance is considered borderline. So it's really important examiners have a good idea of what borderline performance is for the given skill. So the nice thing is it saves lots of time. This is one last step. The information is gathered while the exam is being administered. And then we calculate the passing mark retrospectively as the median checklist score of all the students who are classified as borderline. So you can have a table like this. We have all our borderline students in the middle, and you can take the median score. In this case, it is 49%. And 49% then represents what the experts actually considered to be borderline performance, and we can use that as a pass mark. The problem with the borderline group method is that if only a small group of students is actually classified as borderline, then the median score might not be sufficiently accurate. And if lots of students either clearly failed and clearly passed, and we don't actually have lots of borderline students. So what is introduced is borderline regression. And this takes the scores of all the students into account. So we take all the scores. This is something Excel can do with your results. So I'm not going to go into the exact Excel formula, but you plot, it's effectively a graph. All the student scores are plotted on the y-axis and the global rating on the x-axis. And then you draw a linear regression line through all the scores. And then where that linear regression line intercepts the borderline rating line, you can use as your cutoff score. You do need a large enough group of students the more students you've got, the more accurate this is. So I just want to show you an example. So we've got our global rating along the bottom here, all the marks on the y-axis. So this is the performance of all the students that were categorized in the different ways. The Excel can draw a linear regression line for you. And where the linear regression line meets the borderline group, you can then determine what a pass mark is for that station. So effectively what it does is it shows you the mark that most accurately correlates with what was considered borderline performance for that specific skill. And why this is so important to bring you to the OSCE example. We teach, for example, our GEMP 1 class is about 380 students, and we don't get them in to do the OSCE in one day anymore. We use a programmatic approach. So we bring the groups in at different times to come perform an OSCE. And obviously we can't give every group the same OSCE because it's going to become predictable and the student's performance is then going to be affected by their sort of knowing what the stations are coming. So we give every group a different OSCE with different OSCE stations. Now, the problem is that different OSCE stations have different levels of difficulty. And different OSCE stations have a different concept of what competence is. Like I was saying, you might consider competence in something like CPR or IV cannulation to be a different concept of what minimum competence is in maybe something like history taking or your examination skill. And some stations are just harder than others. If someone needs to, for example, do a lumbar puncture, that's a much harder station than, for example, putting in a nasogastric tube. The students who need to do IV cannulation is much harder than having to do a urine dipsticks. And it's quite hard to make all the stations of equal difficulty because they start to become unrealistic with regards to we want them to represent real life performance. So if I wanted to make a urine dipsticks as hard as a lumbar puncture, I'd probably have to release a swarm of bees into the room or something, but it's completely unnecessary to make a station unrealistically hard just to try and make sure that they kind of have the same pass mark. And from a student point of view, it can't just be unlucky that you happen to get a harder station in your OSCE. We need to make sure that our assessment process is fair and that for every given group who gets a particular group of stations, that they demonstrate minimum competence that's appropriate for the stations that they get. So what we can say is that if you happen to get a harder station, the standard setting will pick that up and it'll probably land up with a lower pass mark than the students who maybe get an easier station. So we can make sure that we've got a fair, accurate assessment across any group of students. And it's not just a case of luck whether you get a harder or easier assessment, but rather we've got a way to say that for any given student, we know whether they've demonstrated minimum competence or not. So the important thing is that your examiners really need to know what it is that you're trying to do. So your examiners need to be familiar with assessment and standard setting purpose. They need to know the content area and the domain being assessed really well. They need to have a really good idea of what the level and expectations of the student are for them to have a proper idea of what minimum competence is for that particular student and what borderline performance would be. And they need to know how difficult the task is. And sometimes we are really grateful that we haven't preset pass marks when a task actually lands up being more difficult than we expected once we see the students performing it in real life. And the examiners need to understand that the consequences of the decisions will be made based on that standard. And the biggest thing for them to understand is what we mean by borderline performance. And then it's really important that they avoid bias. So I'm almost done with the presentation side of things. So just a little bit about what compensatory and conjunctive standards are, because you might have heard of these. So a conjunctive standard requires a student to pass each individual task or skill tested individually. So this is, for example, where you say, not only does your average for the OSCE need to be over a certain percentage, but you need to pass every individual station, or maybe in a theory assessment that the students need to pass not only the overall assessment, but also pass each discipline. So for example, they need to individually pass anatomy and physiology and pathology. And this is really just to prevent strategic studying and prevent gaps in the knowledge, that they know that they can't compensate for weaker areas by studying other areas. But obviously you're going to land up with higher failure rates, and it's a sort of a less reliable way of setting a standard. Compensatory standards are where the scores are combined to form one score which needs to be passed. So that's when you, for example, have a 12-station OSCE and you average it out and just say you need to get an overall pass mark. And this allows for the students to compensate for deficiencies in one area by doing particularly well in others, but it also protects them from, just one disaster, one thing going badly. What we do in OSCE is a sort of a balance of these things where we say they have to pass at least half the stations so that they don't have too many obvious gaps in their knowledge. And then just a little bit about the really important thing, which is what usually causes a lot of student animosity, is the calibration. So I want to make sure that we separate calibration from standard setting. So standard setting allows you to determine a pass mark that genuinely represents competence, that you can make accurate pass-fail distinctions on. So that pass mark is going to be different every time. Sometimes it's 55, sometimes it's 58, sometimes it's 63. And at most universities, they like a fixed pass mark that's pretty consistent. So the WITS AMS likes a pass mark of 60%. So what calibration is when you adjust the marks to meet the fixed pass mark. Importantly, what you do is, say, for example, you use standard setting for your OSCE and the pass mark comes out as 55%. Then anyone who gets above 55% passes and anyone gets below 55% fails. And then what you do is when you calibrate the marks, you just add 5% to all the marks. So the pass mark becomes 60. And if a student did get 56, they will now get 61 and still pass. And if a student got 54, they will now get 59 and still fail. So the calibration is adjusting the marks to a set mark that the university likes, but it doesn't affect pass-fail decisions, and it shouldn't affect distinctions either. So what we normally say is a distinction is 20% above the pass mark. So if you got 75%, then you had a distinction, and after calibration, you'll have added 5% and have 80%. So it's really important not to mix up calibration with standard setting. Standard setting determines the pass mark. Calibration is just adjusting the marks if there is a fixed pass mark at the university that they like you to use. You're still confident that everyone who passed demonstrated competence and everyone who failed didn't. So one of the biggest things is we have a lot of challenges with standard setting in South Africa because it's relatively new. I mean, as you saw, no one at the moment is currently using standard setting, but it is really an important part of validity and very established overseas and very established in the literature. Very few of us who are setting assessments lived under it, so it's very unfamiliar. And as soon as students hear that marks are calibrated, in other words, that marks are somehow adjusted from the original mark they got, they're often quite resistant. And there's often this is poorly understood and explained. So it's really important to explain that this is there to protect students. So this protects students from false negatives, from failing assessments they should pass just because that assessment is unfairly difficult. When I was a student, we had this notorious trauma block that for some reason they used to take pride in their really high failure rate. Because, you know, they would always say like, oh, it's because trauma's so hard, and students these days. And it was really disheartening to study for a test that you knew no matter how hard you studied, they would set this test that was very poorly aligned with the work and they would have this really high failure rate. And we had no evidence. Whereas if there was proper standard setting, there could have been good evidence that it wasn't poorly performing students so much as it was an unfair assessment. And standard setting is also there to protect patients, where we have good evidence to prevent false positives and prevent students going through that maybe are not yet ready for that. And that's especially important with OSCEs where students are demonstrating their clinical competence. And there is a real risk to patients if someone is not actually competent. So remember, this is always still based on your judgment. At the end of the day, you still have an expert sitting in the room deciding on what they consider borderline performance. But at least you've got some indication that your pass mark is meaningful. But it's really important that you adhere to it and that your process is defensible. Also, once you've done standard setting, you really shouldn't condone marks. Once you've established that you've got a mark that genuinely represents competence, then you shouldn't really condone a student that's gotten less than that. So if you set standards and you get a pass mark of 60%, if a student gets 59, then they haven't demonstrated minimum competence. And if you condone a student with 59, effectively you're just saying your pass mark is 59. So once you actually have a pass mark that you're confident represents something, then there should never be a need to condone students. So those are my references, and that's the end of the presentation. So I'm really interested to have a discussion about what people thought. So I see a question from Aviva about the minimum number of students. I've kept trying to look to see if there's sort of an exact number, which I have not been able to find. So it's more of a case of it becomes more and more accurate the more students you've got. But I don't have an exact number for you about what the minimum number of students is. We have OSCEs with about 70 students that we use borderline regression on. But I'm interested in what people's thoughts are. I'd especially like to go back to the beginning of how do you know the pass marks you're currently using is a fair way, because we make big decisions. We use that pass mark to decide who gets to progress and look after patients and who doesn't get to progress and has to repeat or leave the degree. How do you know that your pass mark is an accurate way to do that? How do you know that your 60% represents a fair way to call that cutoff score? And I'm very interested to hear what people have to say. Have I shocked everyone? Viva?
Yeah, I'm going to jump in and ask. The reason I'm asking the question is, I mean, you know, in IPC OSCEs, we have between 40 and 42 students, and the range is quite diverse, from students getting a 90 on some stations to getting less than 50 in others. So I really do want to use standard setting, but it also needs to be fair. And I'm not sure if it then means you must standard set each station and then combine all the marks, or how you would go ahead and do that.
So what we do is we use standard setting for each station. That gives us a pass mark for each station. And then what we do is, once the students have done all 12 stations, then we average out the pass marks to have a pass mark over the whole OSCE. And then average the students' marks, and that gives us our final pass mark. So it allows, if there's easier and harder stations, for that to average out. So we do an individual pass mark for each station, and then the average of that over 12 stations gives us a pass mark for the OSCE, and then the students need to get above that pass mark in order to pass.
Am I the only one where Stuart is frozen? Afternoon.
No, I was just wondering if it was just me.
No, Stuart, I don't know if you can hear us or not, but the VITS network is letting you down. So maybe click out of it and click into it again. I'm going to message him on the side. That might help. But in the meantime, think about the question, which is a good one. Ah, there we go. Okay, he's going to go and come back, I guess. I mean, is it justifiable? And let's think about this. If you're standard setting each station with all their different pass marks, and then you average the marks, are you doing anything to the validity of your exam? And is it then justifiable to develop a different pass mark for that average?
I'm just thinking.
It seems you would be increasing. Sorry, go ahead, Aviva.
Sorry, Prof. I was just thinking the logistics of actually doing that is quite overwhelming, to say the least. But maybe it's just worth an exercise in testing, just like we have been with our MCQs.
I'm back. Can you hear me now? I completely lost my internet, I think.
Yes.
Thanks,
the
VITS network let us down. I don't know how far. I was launching into a long answer to Aviva's question. I don't know how far I got in.
Yeah, we did hear most of it, I think, and what she was saying was the work involved in individually determining a pass mark for each station, and then averaging that. She was saying that's quite labor intensive.
So it's actually, so what we've done is we've got a spreadsheet that our amazing IT people put together. Max here in our unit, that it's actually a very quick thing you can put into Excel. It can calculate a regression line and actually do borderline regression. So all we do at the end of the OSCE is we scan in the results. I copy all the marks into one column. I copy all the global ratings into another column, and it immediately pops out with a pass mark for that station because it calculates it. So it's, apart from putting together the spreadsheet in the first place, it doesn't add any work on. All you need to do is ask your examiners to do a global rating, which is a quick thing that they need to do when they get to the end of their station, and use a spreadsheet that's able to calculate global rating, which is actually, it's not too difficult to do. And it's something Max has showed me, so I should be able to show you. And then it's actually really easy now, because when I enter the students' marks into the spreadsheet, which is what I would do anyway, it automatically calculates the pass mark. And then because we've got such a variety of difficulty of the stations just based on the nature of the skill, it allows us to make sure that no one group just gets unlucky by having maybe a higher proportion of difficult stations or not. But once you've got the formulas into the spreadsheet that you're using anyway, it doesn't really add much work, and you can be really confident. I like the fact that even though we've got a really high pass mark, I can say with confidence that we've used really strict standard setting that it's not just an easy test. I don't know whose hand was next. I see that there's
I think Mervyn was next.
Mervyn.
Thanks, and thanks for a very challenging and very stimulating talk. I'm coming purely from a clinical point of view, and I just wanted to find out more about those borderline performances. You say the examiner is an expert. So I'm just using my own perspective. I wouldn't regard myself as an expert, but I have some knowledge in my field as a specialist. Now, how do you rate the expert in terms of that field? And it's O&G. So if you to use me as an expert, or you to use a very competent general practitioner as the expert, how do you then reach that level where competence is agreed upon? And then my second question is, how do we train the examiners? Because this is obviously the critical issue. Thanks very much.
So I think that is a brilliant question, and it really comes down to, I think, the key place where this either succeeds or fails is an expert in the field isn't always an expert examiner if the examiner doesn't have a good idea of what the appropriate expectations and outcomes for the students in this particular assessment are. So that training the examiners is actually critically important. So for each of our OSCEs, what we do is the person who set the station and taught the students and has a really good idea of what outcomes they wanted from the station sits with all the examiners in that station and actually holds a discussion about what are expectations, what are we expecting. They explain what the students were taught, what the expectations are, what the level the students are at, to try and get a common understanding of what we consider minimum competence to be. But it is definitely the huge challenge, and that's why we say that this is always still a subjective decision about what we consider competence to be. And I think doing things like this is really important, where we can get more people. And if you have an expert in the discipline, for example, in Obs and Gynae, when they come to get involved in exam, it's really important to talk to them about what their expectations would be of the student coming into their clinical setting, and then to have that discussion about this is what they were taught and what we think their level is at and what you think is appropriate. And that's how we can make sure that when the students go into the clinical setting in Obs and Gynae, that the students arriving there are doing so in a safe way where the patients are going to be safe. So I think that discussion becomes the heart of it. And I think it's where you can easily get it wrong. And then you won't have an accurate pass mark at all. So I think when we talk about an expert examiner, they don't necessarily need to be an expert in the field, but they do need to be an expert in examining and understanding what the purpose of the assessment is. So I hope that answers your question, but you hit on very much the heart of where this succeeds or fails.
Thanks, it very definitely does. So the object of the exercise is to train the trainer, or to train the examiner. Thanks. Yes,
and that training is really important. It's often the thing we skip past as well, because we rush people into their OSCE stations because we need an OSCE to start, and it often then affects our outcomes. Prof. Cook.
Sure, thank you for a great presentation. Yeah, I was going to just, I guess, double down on the importance of the very same issue that Mervyn raises, and thank you for your comprehensive answer to his question. We in a sense are doing some sort of consultative ANGOF before we do a borderline regression then. Is that correct? Is that because we sort of all have to get on the same page as to what we see as a borderline competence, for example, or or expert for that matter in the global competence score for that particular OSCE as to what criteria there are that inform that what criteria are met per category essentially. Yes, I guess there are some descriptors that can guide to a point that global competence. But it's a really, would you agree that it's a really, I mean, it's a time-consuming process? Because in the Angoff method, we're saying, look, if you've got an MCQ, would, and not should, but would a borderline student get this correct, yes or no? And there's an efficiency to that, whereas looking at it at an OSCE station, and a lot more time is spent per OSCE. Is that correct in your experience, or not?
So you're exactly right in that an Angoff starts with exactly the same thing, where everyone sits down and decides what they consider minimum competence to be. I think the big difference is I've sat in lots of Angoffs for OSCE stations as well. So what you do in an Angoff, anyone has an experience in Angoff before, is once you've decided on an idea of what a borderline student is, for every item in, say, for example, an MCQ, or in this case, an OSCE, for every item in the OSCE, you need to decide what percentage of borderline students would get this right. And once you've been through every item, then you can say, okay, then what would a borderline student be expected to get once they've completed this assessment? And that is hugely time consuming. If we were to go through, and we've done this, every item for every OSCE with a whole panel of experts, it uses a huge amount of time. So the benefit of using borderline regression is once you've sat and had that same initial discussion about what a borderline student is, you're asking them to make a global impression irrespective of what they've scored on the individual items on the rubric. You really want to say, you know, it's that big question is the student competent and ready for the next stage, or is the student not yet ready? And then because you're making a once-off global impression on the student, you don't need to do it for every item. Once you've established what you're trying to achieve, then for every student, it actually becomes really quick, because at the end of it, you start to get a really good idea. And sometimes it's really easy. Sometimes the student just knocks your socks off and it's clearly excellent, or a student does something bizarre and has clearly failed, and you really get a feel for it. And then I find it goes really quickly. And the examiners actually find it quite intuitive. They sort of deep down, as long as they've really understood. And there's a question in the chat about, do we have to train the examiners ourselves? So the answer is yes, because for every assessment, even if the examiners understand how standard setting works, they need to know what the outcomes are for this particular assessment and what is considered the expectations for that assessment. So it should be part of every assessment. Prof. Cook, that's a new hand?
It is a new hand, because I just wanted to, gosh, this is an excellent discussion, and thank you so much for your inputs. Do we, in your experience, have you had a challenge with, or have you had to consider how the checklist and performance in the checklist impacts the global score in any inappropriate manner? Does it bias it in any way, or have you had to sort of, you know, when we're training the assessors, has that been a consideration in your experience?
So I think that is an important point, because it's very tempting for the examiner to really have an idea in their head of what sort of mark they think looks right as a pass mark. So I think the challenge is to say, you know, for them, that hold the line of like, irrespective of the mark the student's getting, what you consider performance, because it is very easy to be impacted. So from my last session, the whole idea is that you want to put together an OSCE rubric that is rewarding that core competence in the first place. And then they should have an understanding of what bits are the really important bits and which bit aren't. But it is one of the challenges, and I think when someone's new to standard setting, they often use the marking rubric as a guide, and that's where the training becomes really important. I don't know if that answers your question.
Thank you, Stuart. Yeah, no, getting people together and around the OSCE and having a common understanding is therefore moving the subjective into as much of an objective picture as possible is clearly a requisite step. Thank you.
Pleasure. Yeah, I think it's all about, at the end of the day, you land up where you can, you know, sleep easy at night, knowing that everyone that you've passed is out there, not, has demonstrated competence and should be safely out there, and everyone that you failed has not been unjustly failed, because it's really terrible to fail someone that should have passed. And it's really hard to, if you just have which is what most people indicated, that you've been given a pass mark of 50 or 60%, to try set assessments that where 50 or 60 is an appropriate pass mark consistently, and know that you're getting that exactly right every time, and that you haven't actually made it a bit too hard and students are going to fail that actually should have passed, or you've made it a bit too easy. So as soon as you're using standard setting, you can be really comfortable that you've got a really good evidence for the people that have passed and the people that have failed. And what's really nice is that you can get to a point where if you feel like you've got a really great program and really well prepared, excellent students, and you have this really high pass rate, that you can defend that, because you can say, do you know, this isn't just an easy assessment. This is actually quite a tough assessment, but these are great students. And it's really nice to be able to say that, which is, I think, what we're aiming for. So I don't know if there's any other questions. So my question is I'm so glad Aviva said she's going to try this out. How many people are going to go back to where they are and keep using the 50 or 60% that is the prescribed pass mark? So I've mentioned that even though we've got a prescribed 60% pass mark, we still standard set and then use calibration, so we meet the university's prescribed pass mark, but we're still comfortable that we're passing and failing people appropriately. Lots of people would have heard of the Cohens they use in theory, and a lot of the final registrar exams. I think a lot of them use Cohen standard setting now, especially for exit exams. Or are you at least going to go back and ask the powers that be, why is this our pass mark, and how do we know it's appropriate? Oh, so sure, I think that's a really important question. Is we are very, very transparent with the standard setting process we use. I explain it to the students, it's in their handbook, and then it's in a communication I personally send to the students about how their assessment's going to work for the year. But I find that the most important thing is I actually stand up with the students when they come for their first OSCEs and talk about standard setting and why it's there. As soon as students hear that marks might get adjusted, they're really uncomfortable with that. And the thing with OSCEs is often because it's a lot of our stations, have quite a high concept of competence, and it would be quite difficult to make them overly hard. We often land up calibrating down because we land up with, a pass mark that's actually above 60. So the students are not comfortable with that. So I speak to the students about it. Where I usually get the students really on board is because I have 5 different groups of students in each year doing, 5 different OSCEs, where I explain to them it's there as a safety to make sure that it's not just unlucky that one group might get harder stations. And as soon as you say to students, like if you're the group, that gets the lumbar puncture and you hear that another group got to do a nasogastric tube, you're going to feel pretty hard done by. So they need to know that there's some mechanism there to make sure that it's fair across the groups. And as soon as you speak about, it's about being fair, the students I find have gotten on board. And I've had very little pushback to the borderline regression standard setting, but I am very explicit with the students about why we use it. And our ultimate responsibility, which is to patients and patient safety, then they understand. So I don't know, when I was a student, if marks were adjusted, it all happened behind closed doors and in dark rooms and stuff like that. We usually don't tell the students how much the marks were adjusted, but that they know that their standard setting, that each group will have a separate pass mark depending on how hard or easy their particular set of stations was. And that's to make sure that we're making a fair assessment across the groups, which I think is the important thing. And once I explain it to the students, they're usually pretty happy. Especially if they think they're the group that's going to get the IV cannulation and another group gets a urine dipsticks. They want to know that there's some way that they will be protected if they happen to have harder stations. I see a question in the chat. Oh, great. So there are train-the-trainer courses, and I would highly recommend taking part in those. And then one of the things that you need to develop the ability to do is actually train trainers in, for your daily assessment practices. There's 5 minutes less. I don't know if there's any other questions. Standard setting is always a controversial topic. So when it comes to borderline regression, I don't think so. I think there's a talk about because there's no norm referencing, so the students have to pass regardless of how everyone else does. So I think that's really helped with their competitiveness. We're desperately trying hard to talk to the students about how it's about demonstrating competence and moving forward in clinical medicine and not being too caught up about marks. So one of the things that they worry about is, if everyone else does really well, then it's going to make me look bad. So I think one of those things is we just make sure that that the students understand that everyone can pass, and that if everyone's doing well, it doesn't mean we're going to adjust some curve to make sure some students fail. That even if everyone else does well, if they demonstrate competence, they are going to pass regardless of what everyone else is doing. And I think that's an important message to send to them. So I think that's made a difference as well. But our students are super competitive always. I think it's a really hard thing we always try to explain to the students that your class are your colleagues and not your competitors, but I don't know if it's sort of hard to get that message across. Yandisa, the question?
Good afternoon. Yes, thank you. You're talking about the availability of trainer courses. How does one get hold of those, or where does one register?
I think Prof. Cook has put something in the chat. I don't know if Prof. Cook, can elaborate on how you actually sign up and register for those.
Under the Royal College of General Practitioners first, and now within the ambit of the South African Academy of Family Physicians, we've developed a train the clinical trainer, train the clinical assessor course that we will be offering. So Dr. Mlundu is new to our department and very welcome, and also very welcome to join that course that we'll be running for the first time on the 11th.
This is the one you mentioned at last week's meeting on Friday.
Yes, that's it. That's it. But we're hoping to. It's a pilot initiative, and I'm desperate to get both the expertise from UMI and CHSC under Shira's guidance to possibly assist and contribute to our efforts. So it's work in progress, but we're certainly going to give it a good go in that week and go from there.
Thank you.
So thank you, everyone. I hope this has stimulated some interesting thought. I don't know if you thought about your whole career through your studies. If you wonder how pass marks were set, and if you got just over or just under that pass mark, if at the end of the day, that was really a fair representation of what should have been considered competence or not competence. So that's all from me. So thank you, everyone, for the time and for last week as well. This has been really fun. And I look forward to being a part of this again soon.